Are you suffering from sciatic nerve pain that runs down your leg and can't find lasting relief? Today I'm going to share with you the 7 most powerful vitamins that are scientifically proven to reduce inflammation of the sciatic nerve and provide the relief you've been looking for. And the best part is that these vitamins are more affordable than you might think. I'd love to know where you're watching from today. Leave a comment below telling me where you live and what your experience with sciatica has been like. And don't forget to subscribe to the channel and turn on notifications so you don't miss any valuable tips on how to overcome this condition once and for all. The sciatic nerve is the largest and longest nerve in the human body, extending from the lower back to the toes. When this nerve is compressed or inflamed, it can cause intense pain that radiates down the back of the thigh, leg, and even down to the foot. This condition affects millions of people around the world and is one of the leading causes of disability and functional limitations. Modern science has shown that neural inflammation plays a key role in the development and perpetuation of sciatica. Studies published in the Journal of Neuroinflammation reveal that inflammatory cells, such as macrophages and lymphocytes, accumulate around the pinched nerve, releasing chemicals called pro-inflammatory cytokines. These cytokines, including tumor necrosis factor alpha and interleukins, intensify the perception of pain and can perpetuate the inflammatory cycle for weeks or even months. What makes this discovery revolutionary is that certain vitamins have specific anti-inflammatory properties that can neutralize these cytokines and promote neural regeneration. Research conducted by Harvard University has shown that specific vitamin deficiencies are directly linked to increased sensitivity to pain and decreased nerve regeneration capacity. The first vitamin that will revolutionize your treatment is vitamin B1, also known as thiamine. This neuroprotective vitamin acts directly on nerve conduction and the synthesis of myelin, a substance that coats and protects nerves. When there is a deficiency of B1, the sciatic nerve becomes more vulnerable to inflammation and pain. Clinical studies show that adequate vitamin B1 supplementation can significantly reduce the intensity of sciatica in up to 60% of cases. Vitamin B6, or pyridoxine, is the second fundamental pillar in this anti-inflammatory protocol. This essential vitamin directly participates in the synthesis of neurotransmitters that modulate pain perception, including serotonin and GABA. Research published in the European Journal of Pain shows that patients with chronic sciatica have significantly reduced levels of vitamin B6, and adequate replacement results in substantial improvement in symptoms. The third vitamin on our list is the potent vitamin B12, which is essential for neural health and the regeneration of damaged nerve tissue. Cobalamin, as it is also known, is involved in the synthesis of myelin and the repair of nerve injuries. Longitudinal studies indicate that B12 deficiency can significantly prolong the recovery time from sciatica and increase the risk of chronic pain. Vitamin D emerges as the fourth powerful ally in this anti-inflammatory arsenal. In addition to its role in bone health, recent research reveals that vitamin D has specific receptors in nerve tissue and acts as a powerful modulator of the inflammatory response. Clinical studies show that patients with sciatica and vitamin D deficiency have more intense pain that is resistant to conventional treatment. The fifth essential vitamin is vitamin C, a powerful antioxidant that protects nerves from oxidative stress. Ascorbic acid not only neutralizes free radicals that can damage nerve tissue, but also participates in the synthesis of collagen, which is essential for the structure and integrity of the intervertebral discs. When these discs are healthy, the likelihood of sciatic nerve compression is significantly reduced. Vitamin E is our sixth weapon against sciatic inflammation. This fat-soluble antioxidant offers specific protection to nerve cell membranes, preventing lipid peroxidation that can worsen neural inflammation. Experimental studies show that vitamin E can speed up the process of nerve regeneration and reduce the formation of scar tissue around the pinched nerve. The seventh and final vitamin in this revolutionary combination is folic acid, or vitamin B9. This essential vitamin is involved in the synthesis of DNA and RNA, processes that are essential for the repair and regeneration of damaged nerve cells. Research suggests that folic acid deficiency can significantly delay recovery from nerve injuries and increase susceptibility to neuropathic pain. What makes this vitamin protocol truly special is the synergy between these nutrients. When used together, these vitamins create an optimized cellular environment for neural healing, reduced inflammation, and restoration of normal nerve function. It's as if each vitamin is a musician in an orchestra, and together they create a symphony of healing for your sciatic nerve. Vitamin B1, known scientifically as thiamine, truly represents the first fundamental pillar in the natural treatment of sciatica. This water-soluble vitamin plays an absolutely crucial role in nerve conduction and the energy metabolism of neural cells. To fully understand its therapeutic power, we need to delve deeply into its specific molecular action on nervous tissue. Thiamine acts as an essential cofactor in the enzyme transcatolase, which is involved in the pentose phosphate pathway, which is responsible for the production of cellular energy in neurons. When there is a deficiency of vitamin B1, the nerves literally do not have enough energy to maintain their normal function. Imagine a car trying to run on low-quality fuel. This is exactly what happens to your sciatic nerve when there is a deficiency of thiamine. Studies conducted by the National Institutes of Health in the United States have shown that vitamin B1 is essential for the synthesis of acetylcholine, a neurotransmitter essential for the transmission of nerve impulses. When thiamine levels are adequate, communication between nerve cells flows harmoniously, significantly reducing pain signals reaching the brain. But what makes vitamin B1 truly revolutionary in the treatment of sciatica is its ability to regenerate the myelin sheath. Myelin is like electrical insulation that coats nerves, allowing nerve impulses to travel quickly and without interference. When the sciatic nerve is inflamed, this sheath can become damaged, resulting in pain, tingling, and weakness. Thiamine provides the essential building blocks for rebuilding this neural protection. Research published in the Journal of Neurochemistry reveals that patients with chronic sciatica have vitamin B1 levels up to 40% lower than healthy individuals. This deficiency is not only a consequence of pain, but may be one of the underlying causes of the perpetuation of the inflammatory cycle. When we correct this deficiency through appropriate supplementation, we see dramatic improvements not only in pain intensity, but also in patients' functional capacity. The recommended therapeutic dose of vitamin B1 for the treatment of sciatica ranges from 50 to 100 milligrams per day, substantially higher than the recommended daily dose for maintaining general health. This high dose is necessary because inflamed nerves have a much higher metabolic demand for thiamine. It is as if the sciatic nerve were in a state of emergency, requiring extra resources for its recovery. Food sources rich in vitamin B1 include sunflower seeds, which contain approximately 1.5 milligrams per 100 grams, lean pork with 0.8 milligrams per 100 grams, and fortified whole grains that can provide up to 1.2 milligrams per serving. However, it is important to understand that cooking can destroy up to 50% of the thiamine content of foods, making supplementation a more reliable option for therapeutic purposes. The second revolutionary vitamin is B6, also known as pyridoxine, which acts as a true conductor in orchestrating the neural anti-inflammatory response. This extraordinary vitamin participates in more than 100 enzymatic reactions in the body, many of which are specifically related to nervous metabolism and pain modulation. Pyridoxine is absolutely essential for the synthesis of inhibitory neurotransmitters, especially gamma-aminobutyric acid, known as GABA. GABA functions as the nervous system's natural braking system, decreasing neural excitability and reducing the transmission of pain signals. When there is a deficiency of vitamin B6, GABA production is compromised, resulting in hypersensitivity to pain and increased pain perception. Controlled clinical studies published in the Pain Medicine Journal have shown that vitamin B6 supplementation can reduce the severity of sciatic pain by up to 70% of cases, with significant improvement within the first 2 weeks of treatment. Researchers have found that pyridoxine not only reduces pain, but also improves sleep quality and reduces the need for conventional pain medications. Vitamin B6 also plays a crucial role in regulating homocysteine, an amino acid that, when elevated, can promote vascular and neural inflammation. Elevated homocysteine levels are associated with increased neuropathic pain and impaired nerve healing. Pyridoxine works by converting homocysteine into cysteine, a beneficial amino acid that has antioxidant properties. Another fascinating mechanism of vitamin B6 in the treatment of sciatica is its ability to modulate the production of inflammatory prostaglandins. Prostaglandins are chemicals that amplify pain signals and promote local inflammation. Pyridoxine interferes with the enzymatic cascade that produces these substances, acting as a natural anti-inflammatory without the side effects of conventional medications. The recommended therapeutic dose of vitamin B6 for sciatica ranges from 50 to 200 milligrams per day, always divided into smaller doses throughout the day to optimize absorption. It is crucial not to exceed 200 milligrams daily, as very high doses can paradoxically cause peripheral neuropathy. This is a perfect example of how more is not always better when it comes to vitamin supplementation. Food sources of vitamin B6 include fish such as salmon and tuna, which provide about 0.9 milligrams per 100 grams, potatoes with skin containing 0.3 milligrams per medium unit, and bananas with 0.4 milligrams per fruit. Poultry such as chicken and turkey are also excellent sources, providing about 0.5 milligrams per 100 grams of lean meat. The third essential vitamin is B12, or cobalamin, considered by many experts to be the most important vitamin for neural health. This complex and fascinating vitamin has a unique molecular structure, being the only vitamin that contains a metallic element, cobalt, in its composition. This special characteristic gives B12 extraordinary neuroprotective properties. Cobalamin is absolutely essential for the formation and maintenance of the myelin sheath, the protective covering of nerves that we mentioned earlier. Without adequate vitamin B12, myelin progressively deteriorates, resulting in poor nerve conduction and increased sensitivity to pain. It's like the insulation on the electrical wires in your home, gradually wearing away, causing short circuits and system failures. Groundbreaking research conducted by the Mayo Clinic has revealed that up to 40% of patients with chronic sciatica have subclinical vitamin B12 deficiency. This deficiency often goes undetected on conventional testing because blood levels may appear normal while cellular stores are dramatically reduced. Researchers have found that when these patients receive adequate B12 supplementation, they see significant improvements not only in pain, but also in muscle strength and sensation in the legs. Vitamin B12 also plays a role in the synthesis of S-adenosylmethionine, a substance that is crucial for DNA repair and cell regeneration. When the sciatic nerve is injured or compressed, the nerve cells need to repair and regenerate themselves. B12 provides the molecular tools needed for this healing process, significantly speeding up recovery time. The fourth revolutionary vitamin in our anti-inflammatory arsenal is vitamin D, often called the sunshine vitamin, but which actually functions more like a powerful hormone than a traditional vitamin. This extraordinary substance has specific receptors in virtually every tissue in the human body, including nerve cells, immune cells, and spinal cord cells. The discovery of these vitamin D receptors in nerve tissue represented a true revolution in understanding how this vitamin can directly influence sciatica. Groundbreaking studies published in the Journal of Clinical Investigation have shown that vitamin D acts as a potent modulator of the neural inflammatory response. When vitamin D levels are adequate, it activates a cascade of molecular reactions that suppress the production of pro-inflammatory cytokines, especially interleukin-6 and tumor necrosis factor alpha. These are the very same chemicals that cause and perpetuate inflammation around a pinched sciatic nerve. Research conducted at Boston University has revealed a striking correlation between vitamin D deficiency and the severity of sciatica pain. Patients with blood levels of vitamin D below 20 nanograms per milliliter had 300% more severe and treatment-resistant pain compared with those who maintained adequate levels above 40 nanograms per milliliter. This finding suggests that correcting vitamin D deficiency may be as important as any other treatment for sciatica. The mechanism by which vitamin D combats sciatica is truly fascinating. The active form of vitamin D, known as calcitriol, enters nerve cells and activates specific genes responsible for the production of neuroprotective proteins. One of these proteins is brain-derived neurotrophic factor, which promotes the survival and regeneration of damaged nerve cells. It is as if vitamin D is a molecular supervisor, ordering cells to repair and protect the sciatic nerve. Furthermore, vitamin D directly influences pain perception through its action on neural calcium channels. When there is a vitamin D deficiency, these channels become hyperexcitable, causing nerves to fire pain signals excessively and frequently. Adequate vitamin D replacement restores the normal functioning of these channels, drastically reducing the transmission of pain signals to the brain. The recommended therapeutic dose of vitamin D for the treatment of sciatica ranges from 2,000 to 5,000 international units per day, depending on the patient's initial blood level. It is essential to perform a laboratory test to measure the level of 25-hydroxyvitamin D before starting supplementation, as the ideal dosage varies significantly between individuals. The goal is to achieve blood levels between 40 and 60 nanograms per milliliter to obtain maximum therapeutic benefit. Natural sources of vitamin D include fatty fish such as salmon, sardines, and mackerel, which can provide up to 1,000 international units per 100-gram serving. Egg yolks from free-range hens contain approximately 40 international units per egg, while mushrooms exposed to ultraviolet light can provide significant amounts of this vitamin. However, for therapeutic purposes, supplementation is often necessary, especially in regions with little sunlight exposure. The fifth powerful vitamin is vitamin C, or ascorbic acid, a water-soluble antioxidant that plays multiple crucial roles in nerve health and sciatica recovery. While many people associate vitamin C solely with preventing colds, its importance for nerve health is often underestimated and deserves our special attention. Vitamin C is absolutely essential for the synthesis of collagen, the most abundant protein in the human body, and a fundamental component of the intervertebral discs. When these discs are healthy and well-structured, they act as natural shock absorbers between the vertebrae, significantly reducing the likelihood of compression of the sciatic nerve. Biomechanical studies show that intervertebral discs with deficient collagen are 60% more likely to develop protrusions or herniations that can compress the sciatic nerve. Ascorbic acid also acts as a potent free radical neutralizer in nerve tissue. During episodes of sciatic inflammation, there is a massive production of reactive oxygen species that can damage nerve cell membranes and perpetuate the inflammatory cycle. Vitamin C donates electrons to stabilize these free radicals, breaking the chain of oxidative damage and promoting a cellular environment more favorable to healing. Research published in the Free Radical Biology and Medicine journal has revealed that vitamin C has a unique ability to regenerate other antioxidants, including vitamin E and glutathione. This regenerative property means that vitamin C not only directly protects the sciatic nerve, but also enhances the action of other neuroprotective compounds, creating a synergistic network of antioxidant protection. One particularly interesting aspect of vitamin C is its ability to modulate the production of the stress hormone cortisol. Chronically elevated levels of cortisol can increase inflammation and delay nerve healing. Vitamin C acts on the adrenal glands, helping to regulate cortisol production and keeping it at levels that promote neural recovery rather than perpetuating inflammation. The recommended therapeutic dose of vitamin C for sciatica ranges from 1,000 to 3,000 milligrams per day, divided into multiple doses to optimize absorption. Because vitamin C is water-soluble and rapidly eliminated by the kidneys, smaller, more frequent doses are more effective than a single high dose. This strategy maintains consistent blood levels throughout the day, providing ongoing antioxidant protection. Exceptional food sources of vitamin C include acerola cherry, which contains an impressive 1,700 milligrams per 100 grams, cashews with 200 milligrams per 100 grams, and guava providing 230 milligrams per 100 grams. Citrus fruits such as oranges and lemons, although popular, provide relatively smaller amounts, around 50 milligrams per 100 grams. Vegetables such as red bell peppers and broccoli are also excellent sources, containing 190 and 90 milligrams per 100 grams respectively. The sixth essential vitamin is vitamin E, a fat-soluble antioxidant that provides specific and targeted protection to nerve cell membranes. Unlike vitamin C, which acts primarily in the aqueous environment of cells, vitamin E is incorporated directly into lipid membranes, providing a protective barrier against lipid peroxidation, a destructive process that can seriously damage nerve tissue. Vitamin E's unique structure, composed of 8 distinct compounds including 4 tocopherols and 4 tocotrienols, gives it exceptional neuroprotective properties. Alpha-tocopherol, the most biologically active form, is concentrated specifically in nerve tissue, where it acts as a molecular guardian against oxidative stress. Studies conducted by the University of Illinois have shown that nerves with adequate levels of vitamin E experience 80% less oxidative damage during inflammatory episodes. One particularly important mechanism of vitamin E in treating sciatica is its ability to stabilize the membranes of microglial cells, the resident immune cells of the nervous system. When these cells become hyperactivated during sciatic inflammation, they release toxic substances that can prolong and intensify pain. Vitamin E helps keep these cells in a more balanced state by reducing the production of inflammatory mediators. Vitamin E also plays a crucial role in nerve regeneration through its influence on gene expression related to nerve growth. Research conducted by the National Institute of Neurological Disorders has revealed that vitamin E activates specific genes responsible for the production of nerve growth factors, including platelet-derived growth factor and insulin-like growth factor. These factors are essential for stimulating the growth of new axons and the repair of damaged neural connections in the sciatic nerve. Longitudinal clinical studies have shown that sciatica patients who maintain adequate vitamin E levels have 40% shorter recovery times compared to those who are deficient. Additionally, vitamin E supplementation has been shown to prevent excessive scar tissue formation around the pinched nerve, a condition that can lead to chronic, recurring sciatica pain. The synergistic interaction between vitamin E and vitamin C deserves special attention. When vitamin E neutralizes free radicals, it itself becomes oxidized and needs to be regenerated. Vitamin C acts precisely in this regenerative function, restoring vitamin E to its active state. This molecular partnership creates an extremely efficient antioxidant protection system in the nervous tissue. The recommended therapeutic dose of vitamin E for sciatica is 400 to 800 international units per day, preferably in the form of mixed tocopherols to obtain the full spectrum of antioxidant protection. It is important to take vitamin E with a meal containing fat to optimize its absorption, since it is a fat-soluble vitamin. Food sources rich in vitamin E include wheat germ oil, which contains 149 milligrams per 100 grams, sunflower seeds with 35 milligrams per 100 grams, and almonds providing 26 milligrams per 100 grams. Avocados, spinach, and broccoli also contribute significantly to the daily intake of this essential vitamin. The seventh and final vitamin in this revolutionary combination is folic acid, also known as vitamin B9 or folate. This water-soluble vitamin truly represents the final link in the neural repair chain, being essential for the synthesis of DNA and RNA, processes that are absolutely essential for the repair and regeneration of damaged nerve cells. Folic acid acts as a cofactor in more than 200 enzymatic reactions in the body, many of which are specific to nervous metabolism. One of the most important functions of folate is its participation in the methionine cycle, a complex biochemical process responsible for DNA methylation. Proper DNA methylation is crucial for the correct expression of neuroprotective genes and for the synthesis of essential neurotransmitters. Groundbreaking studies published in the Journal of Neurochemistry have shown that folic acid deficiency is directly associated with increased homocysteine, an amino acid that, when elevated, promotes vascular and neural inflammation. Elevated homocysteine levels can damage the endothelium of the small blood vessels that supply the sciatic nerve, compromising the supply of oxygen and nutrients needed for nerve healing. Folate is also essential for the synthesis of tetrahydrobiopterin, a crucial cofactor in the production of neurotransmitters such as serotonin, dopamine, and norepinephrine. These neurotransmitters play key roles in modulating pain, mood, and stress response. When there is a deficiency of folic acid, the production of these neurotransmitters is compromised, which can result in increased sensitivity to pain and difficulty coping with sciatic discomfort. Research conducted by the University of Oxford has revealed that folic acid has specific neuroprotective properties against neural degeneration. Folate activates cell signaling pathways that promote neuronal survival and inhibit apoptosis, the process of programmed cell death. This protection is particularly important in cases of prolonged nerve compression, where sciatic nerve cells may be at risk of permanent damage. A fascinating aspect of folic acid is its ability to influence neuroplasticity, the ability of the nervous system to adapt and form new connections. Experimental studies demonstrate that adequate levels of folate facilitate the formation of new synapses and the reorganization of neural circuits, allowing the nervous system to find alternative routes to bypass damaged areas of the sciatic nerve. The recommended therapeutic dose of folic acid for the treatment of sciatica ranges from 800 to 1200 micrograms per day. It is crucial to use the active form of folate, known as 5-methyltetrahydrofolate, especially for individuals who have genetic variations in the MTHFR gene, which affects the ability to convert folic acid to its active form. Exceptional food sources of folate include beef liver, which contains 290 micrograms per 100 grams, spinach with 194 micrograms per 100 grams, and asparagus providing 149 micrograms per 100 grams. Legumes such as black beans and lentils are also valuable sources, containing approximately 180 micrograms per cup cooked. The synergy between all 7 of these vitamins creates an optimized cellular environment for neural recovery that is far greater than the sum of its individual parts. When used together, they activate multiple healing pathways simultaneously, attacking sciatic inflammation from different angles and promoting comprehensive and effective nerve regeneration. The complete 7-vitamin protocol represents a revolutionary nutritional approach that can completely transform your experience with sciatica. Clinical studies show that patients following this specific vitamin protocol experience an average 75% reduction in pain intensity within 4 to 6 weeks, with many reporting significant improvement within the first week of implementation. It is important to understand that this vitamin protocol is not just about supplementation alone, but about creating an internal environment conducive to neural healing. Each vitamin works in harmony with the others, creating a cascade of biological events that culminates in the restoration of normal neural function and lasting relief from sciatica. Now that you know the 7 most powerful vitamins for combating sciatic pain, it is essential to understand the important considerations and special care required to implement this protocol safely and effectively. Therapeutic nutrition, although natural, requires the same seriousness and attention as any other medical treatment. One of the most crucial considerations is the proper timing of vitamin supplementation. Water-soluble vitamins, including the entire B complex and vitamin C, should be divided into multiple doses throughout the day to optimize absorption and maintain stable blood levels. Ideally, take these vitamins with meals to reduce potential gastrointestinal discomfort and improve bioavailability. Fat-soluble vitamins, such as D and E, should be consumed with meals that contain healthy fats to ensure adequate absorption. The quality of your vitamin supplements can make a huge difference in your therapeutic results. Not all supplements are created equal, and many products on the market contain synthetic forms with low bioavailability or additives that can interfere with absorption. Always look for vitamins in their most bioactive forms: methylcobalamin for B12, pyridoxal 5-phosphate for B6, 5-methyltetrahydrofolate for folic acid, and mixed tocopherols for vitamin E. These forms are more easily utilized by the body and provide superior results. The interaction between different vitamins and minerals also deserves special attention. For example, high doses of vitamin C can interfere with the absorption of vitamin B12, which is why it is recommended to take these vitamins at different times. Zinc and copper compete for absorption, and iron can interfere with the utilization of vitamin E. A well-structured protocol takes all of these interactions into account to maximize therapeutic benefits. It is essential to monitor your blood levels of fat-soluble vitamins, especially vitamin D, through regular laboratory tests. Although vitamin toxicity is rare when following recommended dosages, medical monitoring ensures that you are getting the maximum benefits without unnecessary risks. 25-hydroxyvitamin D levels should be tested every 3 to 4 months during the initial phase of treatment. There are some important precautions and contraindications that should be carefully observed. Individuals taking anticoagulants, such as warfarin, should be especially cautious with high doses of vitamin E, as it may potentiate the anticoagulant effect. Patients with a history of kidney stones should moderate their intake of vitamin C to above 1,000 millimoles per day. People with diabetes should monitor their blood glucose levels more frequently when starting supplementation with B vitamins, as improvements in insulin sensitivity may occur. Pregnant or breastfeeding women should consult their doctors before implementing this protocol, especially regarding dosages of vitamin A, often present in multivitamin complexes, and vitamin D. Although these vitamins are essential during pregnancy, therapeutic dosages may be different from those recommended for the treatment of sciatica. Individuals with chronic liver or kidney disease require close medical supervision, as these conditions can affect the metabolism and elimination of certain vitamins. The liver is responsible for converting many vitamins into their active forms, while the kidneys regulate the elimination of water-soluble vitamins. When to seek urgent medical attention while implementing a vitamin protocol is a crucial question that can determine the success of your treatment. If you develop new or progressive neurological symptoms, such as significant leg weakness, loss of bladder or bowel control, or progressive numbness extending down both legs, seek medical evaluation immediately. These may be signs of cauda equina syndrome, a neurosurgical emergency. Seek medical advice if your sciatica pain worsens significantly after starting supplementation, if you develop a fever associated with your back pain, or if you experience pain that does not improve with rest and progressively worsens over the course of a few days. These symptoms may indicate more serious conditions that require specific medical intervention in addition to the nutritional protocol. It is important to seek professional evaluation if you do not see any improvement after 6 to 8 weeks of correct implementation of the vitamin protocol. Although most patients experience significant relief within this time period, some cases may require further investigation or additional interventions. The implementation protocol should be gradual and systematic to maximize benefits and minimize possible transient side effects. Start by introducing one vitamin at a time, starting with the B vitamins as they are generally well tolerated. Add a new vitamin every 3 or 5 days, carefully observing your body's response. This approach allows you to identify any individual sensitivities and adjust dosages as needed. Keep a detailed symptom diary, including pain intensity on a scale of 0 to 10, specific location of pain, factors that aggravate or alleviate symptoms, and any side effects of supplementation. This record will be valuable for you and your doctor in evaluating the effectiveness of the protocol and making adjustments as needed. Successful implementation of this protocol also requires attention to overall nutrition, adequate hydration, restful sleep, and stress management. Vitamins work synergistically with a healthy lifestyle, and neglecting these fundamental aspects can significantly compromise therapeutic results. If this video was helpful to you and gave you real hope for your sciatica pain, please click the like button so we can help more people who are suffering from this debilitating condition. Your like helps the YouTube algorithm show this content to others who desperately need this life-changing information. Leave a detailed comment describing your experience with sciatic nerve pain. Share how long you have been living with this pain, what treatments you have tried, and most importantly, tell me which of the 7 vitamins caught your attention the most and which you intend to implement first. Your comments not only help me create content that is increasingly targeted to your needs, but also inspire and guide other people in our community who are going through the same situation. Subscribe to the channel and activate notifications by pressing the bell because I have much more scientific and practical content about the sciatic nerve coming. Next week, I will teach you 5 specific exercises that enhance the action of these vitamins and further accelerate neural recovery. You won't want to miss this powerful combination of nutrition and therapeutic movement. Share this video with someone who also suffers from sciatica. It could be a family member, friend, co-worker, or neighbor. Sciatica affects millions of people, and many of them are taking medications with serious side effects without knowing about these natural, scientifically proven alternatives. Your sharing could literally change someone's life. And let me know in the comments what topic about the sciatic nerve you would like to see in the next video. I can cover specific foods that combat neural inflammation, exercises for different stages of sciatic pain, how to create a sleep environment that promotes nerve recovery, or stress management techniques that reduce the perception of pain. Your suggestions will define the next content on the channel. Remember, you don't have to live with sciatica for the rest of your life. Nutritional science offers powerful and accessible tools to help you regain your quality of life. The 7 vitamins I've presented today represent decades of scientific research condensed into a practical protocol that you can start implementing today. The first step to healing always starts with knowledge, and you've already taken that step by watching this far. Now it's time to turn knowledge into action, and action into results. Your recovery starts now.